Welcome, I'm Dr. Melina Roberts, and I want to talk about arthritis because I think a lot of people in our society think that arthritis is a progressive degenerative disorder that they just have to learn to live with. And a lot of people think that everyone's just going to get arthritis at some point in their life. But what we really need to do is we really need to gain a deeper understanding of what's actually happening in arthritis and what our body is trying to communicate to us. Because really, 1 in 6 Canadians actually suffer from arthritis and actually experience, most of them experiencing moderate to severe pain. So this is pretty significant. And what arthritis actually means is arthritis literally means inflammation in the joints. Now, what we need to know is that what does pain mean? Now, when we experience any sort of pain in the body, that's our body's early detection system that something is wrong. It's like touching that hot stove. Immediately we'll take our hands off of it because it's communicating to our brains, to our bodies, that something is wrong. Now, the other thing that we talk about as well is we talk about inflammation. Now, what inflammation is inflammation is the way that the body is trying to send healing agents to an area of the body in order to try to get some healing happening in that area. So often you'll get a lot of swelling in the area, and when you get that swelling, that's really what the body's trying to do. It's trying to get more healing agents to that area in order for us to be able to do proper healing. So we need to understand that the pain and inflammation are things that we need to understand and respond to it appropriately. And then if we can do that, then we can get proper healing to happen. Because if we're just taking things like painkillers, anti-inflammatories, steroids in order to suppress the symptoms of arthritis, of pain and inflammation in joints, then what can happen is that we can actually have increased damage to those joints because now you're ignoring those pain signals and you're decreasing the inflammation, so you can actually have a breakdown of those joints. So there's 2 contributing factors to arthritis. One is that we have an increased toxic load in the body. And what's happening is that that toxic load is actually making its way into the joint spaces and causing a large amount of that inflammation and pain in the area. And the challenge is that that is actually telling us that, first of all, our body is taking in a high amount of toxic load. And the second part is that we're not effectively able to move that toxic load out. So what's happening is that that toxic load is actually accumulating within our bodies and causing problems. So the second contributing factor to arthritis is actually nutrient deficiencies. So our body doesn't have enough nutrients in order to do the repair of the cells and the joint spaces. So when we talk about nutrient deficiencies, we got to think about how much nutrients we're actually taking in through our diet or through supplements. And the other thing that we got to think about as well is how well our body is able to absorb the nutrients from the foods we're eating. And so these can be contributing factors to why we're getting a deficiency in a number of nutrients in the body. So these are really 2 contributing factors to why arthritis can develop in the body. So our approach to arthritis is that, first of all, we want to make sure we decrease that toxic load in the body and ensure that the organs of detoxification are working at their best, so our bodies can effectively move that toxic load out. So those major organs of detoxification are liver, kidneys, lymphatic system, colon. So these are just ways that your body can effectively move that toxic load out of the body. The second thing we want to really focus on is healing up the digestive tract. And when we heal up the digestive tract, that allows the body to be able to properly absorb the nutrients from the foods we're eating. So the third thing that we want to do is we want to make sure the body has all of the proper building blocks to help do the repair of the joints. So this is our approach to arthritis, and I really think that if we can listen to our bodies and then respond appropriately to it, that we can really help the body to function better and that people really don't have to suffer with arthritis. Thank you so much for listening. I hope that you will share this information with your friends and family. You will press the like button, make a comment below, and until next time, continue to learn, grow, and build health.